Right, let's discuss the mandible. So we'll start off with the anatomy of the mandible. Here we have the head of the mandible, or the condylar process. This is called the coronoid process right here. This right here, indent right here, is called the mandibular notch. This here is called the oblique line. This here is, right here, is the angle of the mandible. This part of the mandible is referred to the ramus of the mandible. This is the body of the mandible. This is the alveolus. This here in the midline is called the symphysis. This is the mental foramen, which we'll talk about in a second. This is the mental foramen on the other side. We'll flip the mandible over on its undersurface, and we see here is the mylohyoid line, which the mylohyoid muscle will attach to. Here we can see a foramen. This is called the mandibular foramen. And the inferior alveolar nerve will pass through this foramen. The inferior alveolar nerve and artery will pass through this foramen and then exit from the mental foramen here. And so the inferior alveolar nerve is a branch of V3, which is a branch of the trigeminal nerve. And so the inferior alveolar nerve will supply sensation to the lower teeth here, to the nerve roots of the lower teeth. And once it exits through the mental foramen on this side, the name of the inferior alveolar nerve will change to the mental nerve. And the mental nerve will supply sensation to the lower lip and chin area. So we can have fractures of the mandible, and the fractures have different names. So if you have a fracture right down the midline, that's called a symphyseal fracture. If it's off the midline to either side, it's called parasymphyseal fracture. A fracture over here is called a fracture of the body of the mandible. You can fracture here at the angle, you can fracture the coronoid, you can also fracture the condylar head. And so when a patient comes in with a mandible fracture, one of the most important things that we assess for is occlusion. And we'll take a look at that with our rest of our specimen. So here I'm just going to attach the mandible back to the rest of the skull. Okay, so we can take a look at the occlusion here. This is not a great specimen to assess occlusion, but the occlusion can be forward projected or project backwards. And so class 1 occlusion is normal. Class 2 occlusion occurs when the mandible is shifted backwards or posteriorly, and class 3 occlusion occurs when the mandible is shifted forward or anteriorly. We can talk about the muscles of mastication here on this specimen as well. So the most powerful, so you have 4 muscles of mastication. The most powerful per square inch is the masseter muscle, and it's going to attach to the zygoma here and to the mandible right here. And the masseter muscle also forms a sling with the medial pterygoid muscle. So the medial pterygoid attaches on this side and then attaches to the medial pterygoid plate here. The lateral pterygoid muscle will attach to the lateral pterygoid plate right here and attach to the TMJ joint here, and it's the only muscle of mastication that actually lowers the jaw. The most powerful muscle of mastication is actually the temporalis muscle, and the temporalis muscle sits right here and will attach to the coronoid process here to raise the mandible